80 years long, and we have a true victory now with the passage of H.R. 3962 in the House of Representatives. So I just want everybody to take a moment and pat yourself on the back for all the hard work you've done in making that happen. Woo! It's been a long road, but we got in there. Today we're here to thank our champion, Brian Higgins, for his work in Congress. As a member of the Ways and Means Committee, he has kept this on the forefront of the issues. He's made sure that the legislation was strong. He's been a champion for us here in Western New York, and he voted yes for H.R. 3962 last Saturday. So thank you very much. I work with a lot of families that don't have health insurance. I work with families that do have health insurance and are worried about the costs that are rising and the coverage that's going down. I work with unions. I work with small businesses. All of them are concerned about their health coverage, but this legislation is going to give them access to quality, affordable health insurance. And the House's legislation as it stands now is the best option that we have. It contains the public option, it has true affordability, it's a great bill. So we really stand with Congressman Higgins and the rest of the members of the House of Representatives that passed this bill to make sure when the two bills are reconciled that all these great aspects of H.R. 3962 are the ones that come forth in a bill that President Obama can sign. So I want to thank all of you for being here today. I especially want to thank you, Congressman Higgins, for that, and we're going to have several people that are going to come up here and express their views.
Good morning, everyone. Good morning. Let's cheer. Today's a celebration. Last week, we made history, not only in Western New York, but all across America. People like you came together to make the phone calls and encourage our representatives, Congressman Higgins, to do the right thing. So on behalf of 10,000 members that we have all across Western New York, from here to Rochester, 2 million members nationwide, we want to thank you, Congressman Higgins, for standing up for us and for doing the right thing.
All right. 1 minute. I never talked for a minute in my life. You know, first of all, Extreme Makeover's in town, and there's a reason Extreme Makeover's here, because we have a congressman that is an extreme makeover. Look at the waterfront, look at healthcare, look at the leadership here. That's why we're here to give him a thanks, because of everything he's done. And I can't express that enough. And right now, we're in a fight for healthcare in Erie County, as you know, for the clinics. We need your support on that. We've got to get back to this basic of fighting for people. Too much politics in this community right now. It's about what the people deserve. And this guy has led the charge. From day one, I met him at the Ford plant, at the back gate, saying he's going to bring change in Erie County, he's going to bring change in Western New York, and he's done that. And I tell you what, I was personally, my wife Diane over there, and I were in Washington last Saturday. We waited in the gallery. We missed him by 20 minutes to see him on the floor speak, but we seen him on TV. But I'll tell you what, the opposite side kept pointing to this big document, the Pelosi bill, the Pelosi bill. It does nothing for the people. That's wrong. They didn't want to come to the table. They never want to come to the table. We are in trouble with the other side because all they want is one-sided. There's no compromise. You got to come out and compromise if you want to change this country. This guy has done the job. I can thank you enough, Brian Higgins, for all you've done. I appreciate everything you've done. Thank you, sir.
Thank you very much, everybody. Bobby Reynolds, my great friend and member of the county legislature, Diane, for the great leadership that you've shown from the very, very early days of healthcare reform, at least in this century. Gretchen for the American Cancer Society, Larry, Peggy, Terry, my great friends. You guys are always with me and very, very supportive. Francelle, Sharon, Wendy, Jeanette, Marilyn, not only a great advocate of the public plan, but a great fan of the New York Yankees. Bob Reynolds, and let me just recognize one other fellow who I've met a couple of years ago in Washington. He's from Chautauqua County. His name is Bob Williams. He came all the way here from Chautauqua County to be with us. But he's familiar with this route because he's a volunteer for the American Cancer Society. And what Bob does, and has been doing for many, many years, he drives cancer patients to their treatment at Roswell Park Cancer Institute from Chautauqua County. My great friend Bob Reynolds, or Bob Williams, thank you very, very much. As Diane and others have said, you know, we have been embroiled in a pretty significant debate over the past several months. And I often say, as a member of the Ways and Means Committee, I've learned an awful lot about healthcare. I've learned an awful lot about America. I've learned an awful lot about politics. I have a lot more to learn. This has been an extraordinary process. It's been replete with fact distortion, verbal manipulation. You know, when I got involved in government, I believe that good facts win out at the end of the day. A good, rigorous debate based on factual information. When I see members of Congress, in the House and the Senate, deliberately mislead people to confuse them because they oppose any progress in healthcare reform, it's shameful. It's shameful.
Amen.
And this nation, this good and generous nation, is much better than that. Here's what I came to learn. When the healthcare debate started, this amorphous concept called the public plan was advanced, and nobody really defined it. And we received a letter from the president when this debate kicked off, and he made reference to two places, the Cleveland Clinic and the Mayo Clinic. Now I know the quality of the Cleveland Clinic. People from all over Western New York, despite having a significant health care infrastructure, travel to the Cleveland Clinic. Why? Because of the quality.
Right.
So what I decided to do, in addition to all the reams of documentation that we had to go through, I called the president of the Cleveland Clinic. His name is Dr. Toby Cosgrove. And I just said, look, can you help me understand, why is it that everybody's making reference to you? What is it that you do different? Well, after about an hour, the lights went on. The Cleveland Clinic is a public plan. It's a not-for-profit. The monies that are made there are invested back into healthcare. It is highly integrated. It is highly coordinated. At the Cleveland Clinic, they put patients over profits. They put quality over quantity. They put value over volume. We talk about electronic medical records. It is shameful that in this community, less than 10% of doctors' offices, doctors' practices, have electronic medical records fully implemented. In London, it's 95%. In New Zealand, it's 98%. The point is, you can't do all the things that we're trying to do, move from fee-for-service to full quality, complete care for the patient without electronic medical records. We should have a strong public plan. Why? Because we need a countervailing force to private, for-profit insurance. You know the individual stories of what the private insurance companies do because they can. There's no competition. We need a countervailing force, a strong countervailing force, and that's found in a strong public plan. It's found in a strong public plan. Healthcare in this nation is a $2.5 trillion industry. $2.5 trillion. It's 17% of the gross national product. 17% of the American economy. Health insurance premiums have doubled in the last 10 years and they'll double again. And as they continue to grow, these costs at 3, 4, 5, 6 times the rate of inflation, people lose their health care. That is the leading contributor to people losing their health care. 14,000 people every single day lose their health care. That's wrong. It's wrong. So you pay $2.5 trillion, more than 50% of any industrialized nation for health care. We should be number one, right? According to the World Health Organization, we're 37th in overall quality. We can do better in America.
That's right.
We're 41st in infant mortality. That means in 40 other countries, kids from birth to 1 year of age live in higher percentages than they live in America. That's wrong in this country. We can do much better. We're dead last in preventable deaths out of any industrialized nation. We can do much better. People in this nation should be indignant that we haven't made more progress. This has been a debate that's been going on for 70 years. And I often say that healthcare reform in this nation doesn't need a finish, it needs a start. We're going to get a start this year when the House and the Senate come together, do a plan with a strong public option, and the President signs into law by the end of the year. Thank you for your leadership. Thank you for all your support.